Hello, everyone, and welcome back to another episode of Beyond Reality, where we dive deep into the rapidly evolving intersection of virtual reality, artificial intelligence, and neural rehabilitation. I'm your host, Brianna Hodge, and as always, I'm thrilled to explore some of the most thought-provoking issues in this exciting field. Today, we're turning our attention to a topic that is often overlooked, but is absolutely critical as VR becomes more integrated into patient care: ethics. Specifically, we're asking the big questions around how we can balance the drive for innovation with the responsibility to ensure patient safety. As new technologies emerge, it's easy to get swept up in the potential benefits, but there are also risks, especially when vulnerable populations are involved, like those recovering from neurological injuries. And to help us unpack this topic, I'm joined by my incredible co-host, Lyra Thorne. Lyra, you've been such a voice of reason when it comes to navigating these new technologies, so I'm really excited to get your perspective on the ethical dimensions of VR rehabilitation.
Thank you, Brianna. It's always such a pleasure to be here. And you're right, today's conversation is really critical, especially as we're seeing such rapid advancements in VR technology being used in rehabilitation settings. We have to keep in mind that while this technology holds so much promise, it also comes with responsibilities. Responsibilities to our patients, to the broader healthcare system, and even to society as a whole. I'm really looking forward to diving into all of these angles today.
Exactly, Lyra. I think one of the first questions we have to tackle when it comes to VR and rehabilitation is, what are the core ethical concerns? I mean, we've seen how transformative this technology can be, but I imagine that with every new opportunity comes new challenges. So, when you think about VR in a therapeutic context, what are the most pressing ethical issues that we need to address?
That's a fantastic question, and it's a complex one because there are layers of ethical considerations that we need to peel back. First and foremost, patient safety is at the top of the list. With any medical or therapeutic intervention, we have a duty to do no harm. In the context of VR, that means ensuring that the technology we're using doesn't cause any adverse physical or psychological effect. This could be something as straightforward as ensuring that the hardware is safe, no motion sickness or physical discomfort caused by extended VR sessions, or something more nuanced like making sure that the content of the VR scenarios is appropriate for each patient's condition. For example, a study published in Frontiers in Psychology examined how virtual environments could trigger adverse emotional responses in some patients. The study highlighted that while VR can be an excellent tool for exposure therapy, such as treating anxiety and PTSD, it can also trigger intense reactions if not carefully monitored. Patients may be overwhelmed by certain simulations, which underscores the need for individualization and clinical oversight in therapy. In addition to safety, we also have to think about issues like consent and autonomy. When a patient agrees to use a VR as part of their rehabilitation, they need to understand exactly what that entails, not just in terms of the immediate treatment, but also in terms of data collection. VR systems collect massive amounts of data on patient movements, responses, and even cognitive functions. This data can be incredibly useful for therapists, but we need to be transparent about how it's used, who has access to it, and how long it's stored.
Those are all such important points, Lyra. I love how you broke that down because I think it highlights just how multifaceted the ethical landscape is here. You've got the immediate concern of patient safety, but then you also have these broader systemic issues, like consent, data privacy, and equity. Let's talk more about accessibility, because that's something that I think people might not immediately consider when they think about new technologies. There's always that initial wow factor, but as you mentioned, if VR is only available in state-of-the-art facilities, doesn't that create a kind of healthcare divide? What's your take on how we can make VR and rehabilitation more equitable?
That's a huge concern, Brie, and one that we're already seeing play out in the real world. Like you said, there's this wow factor, and in the best-case scenarios, patients who have access to VR in their rehabilitation often report incredible results: faster recovery times, improved engagement, even better mental health outcomes because the therapy is so immersive and motivating. But the reality is that not all rehabilitation centers have the resources to invest in this kind of technology, especially smaller or rural clinics. There's a study from Journal of Neuroengineering and Rehabilitation that demonstrated how VR technology in stroke rehabilitation led to significant improvements in motor recovery. But the study also noted that this intervention was most accessible to patients in larger urban hospitals. Patients in rural areas or smaller community clinics often lack access to these cutting-edge tools, which can create disparities in care. One potential solution is telerehabilitation, where patients can access VR therapy remotely, perhaps through a home system. Research is already showing promise in this area. A review in Journal of Telemedicine and Telecare highlighted how home-based VR therapy for patients with stroke and multiple sclerosis significantly improved patient outcomes. With advancements in cloud-based VR systems, this could become a more affordable option for patients who can't physically come to a facility equipped with VR.
Yes, telerehabilitation is such an exciting prospect, especially when we think about extending care beyond the walls of a clinic or hospital. You're right that the economic argument could help drive more widespread adoption of VR in rehabilitation. If healthcare systems and insurers can see the return on investment in terms of faster recoveries and fewer readmissions, they might be more willing to support its broader use. I want to switch gears for a moment and talk about something you touched on earlier: psychological safety. You gave the example of VR potentially triggering trauma for patients with PTSD. Can you expand on how psychological risks play into the ethics of using VR in rehab? Are there specific safeguards we should be implementing to make sure that VR is mentally safe for patients as well?
Psychological safety is often overlooked because when we think about patient safety in VR, the physical aspects are more obvious. However, the psychological risks are just as real and can be even more damaging if we're not careful. One example comes from a study on veterans using VR for pain management. Published in Military Medicine, the study demonstrated that while VR was effective for managing chronic pain, it sometimes triggered traumatic memories in veterans with PTSD. This incident shows how a seemingly benign virtual environment could inadvertently harm a patient if their mental health history isn't considered. To mitigate this, therapists need to carefully screen patients and tailor VR sessions to their emotional and psychological needs. Informed consent becomes even more critical here. Patients need to understand that while VR can be beneficial, there are potential emotional triggers, and they should feel comfortable voicing discomfort at any time during the session.
That example really illustrates how important it is to be mindful of psychological safety. The immersive nature of VR is one of its greatest strengths, but it's also what makes it potentially risky if not carefully managed. And I love what you said about individualization. It's not a one-size-fits-all approach. Clinicians need to be well-versed in both the technology and the mental health aspects of VR. Which brings me to my next question. Do you think there's enough training out there for therapists who are using VR in rehabilitation? Should we be doing more to prepare healthcare providers for these ethical challenges?
Training is a huge area where we need to do more, absolutely. Right now, many healthcare providers are learning the technology as they go, which is fine in some respects because VR is still relatively new in this field. But when we're talking about patient safety, both physical and psychological, we can't afford to have a learn-on-the-job mentality. There needs to be structured, comprehensive training programs that cover not just the technical aspects of using VR, but also the ethical considerations we've been discussing today. An excellent resource is the Foundational Virtual Reality Therapy Certification Program, created by Neuro Rehab VR, which covers the ethical challenges such as informed consent and data privacy, as well as clinical applications of VR. A review in Journal of Medical Internet Research found that clinicians trained in VR use were significantly more likely to safely and effectively integrate VR into patient care.
I completely agree, Lyra. Comprehensive training programs like the Foundational Virtual Reality Therapy Certification Program can really help set the standard for ethical VR use in rehabilitation. It's not just about learning how to operate the technology, it's about understanding the broader implications, especially when you're working with vulnerable populations. Do you have any advice for therapists or healthcare providers who are just starting to explore VR in their practice?
I think my main advice for healthcare providers just beginning to integrate VR into their practice is to approach it with a healthy mix of excitement and caution. VR offers incredible potential to transform patient outcomes, but it's essential to remember that it's still a tool. The key is not to rely solely on the technology, but to use it as part of a broader patient-centered care strategy. Always prioritize individual patient needs, continuously evaluate the ethical implications of its use, and remain open to learning. One more thing I'd emphasize is collaboration. Therapists don't have to go it alone. Reach out to colleagues, attend workshops, get certified, and stay informed about the latest research. The field of VR in rehabilitation is evolving rapidly, and staying connected with others who are navigating the same terrain can make a big difference in providing safe and effective care.
Such excellent advice, Lyra. I think the idea of collaboration really resonates, especially in a field like VR, where the technology is so dynamic. By sharing our experiences and learning from each other, we can collectively raise the bar for how VR is integrated into patient care. And as you said earlier, it's not just about being tech-savvy, it's about being patient-savvy, understanding the individual's journey, and ensuring that safety and ethics are at the forefront of every decision. Before we end, I'd love to briefly touch on how Neuro Rehab VR is addressing these ethical concerns. We have been making strides in designing solutions like the XR therapy system, which focuses heavily on patient safety by creating customizable experiences that cater to the specific needs of individuals. The platform emphasizes transparency, control, and personalization for both patients and clinicians, offering safeguards that ensure ethical use of VR.
Yes, Brie, that's a key example. Neuro Rehab VR's approach is a great reflection of what we've been discussing. The XR therapy system is designed not just for maximum engagement, but also to ensure that the therapy is grounded in clinically validated frameworks. Therapists are able to tailor each session based on a patient's physical and psychological comfort levels, which significantly reduces the risk of overwhelming patients or triggering adverse reactions. It's those safeguards that help to mitigate the potential ethical dilemmas we've highlighted today.
Exactly, Lyra. And while it's important to recognize the amazing potential that VR has in rehabilitation, it's equally important to acknowledge that platforms like the XR therapy system from Neuro Rehab VR are thoughtfully developed to ease the concerns that come with adopting new technologies. What's exciting is how our team is creating opportunities for better patient outcomes while also keeping safety as a top priority. It's clear that a company can play a big role in shaping the future of VR rehabilitation by building in those ethical considerations from the ground up.
It can be encouraging for therapists to see how platforms like the XR therapy system are integrating these ethical elements early on. It not only expands the possibilities of VR therapy, but also of making sure the technology remains patient-centered. By incorporating features that allow therapists to monitor progress in real time and adjust protocols as needed, our system prioritizing safety while ensuring that the innovation doesn't come at the expense of patient care.
It's definitely reassuring to see that there are solutions to the issue, showing that innovation and ethics don't have to be in conflict. They can actually support each other. If VR platforms can continue to take this thoughtful, ethical approach, it will really set the tone for how the field of VR in rehabilitation evolves over time. We can take full advantage of what this technology has to offer, while also ensuring that patient safety and well-being are never compromised.
Exactly, Brie, and that's why I think the future looks bright. When companies invest in building thoughtful, ethically sound systems like the XR therapy system, it sets a strong example for the entire industry. These steps show that it's not just about being at the cutting edge, but about making sure that cutting edge is safe and effective for everyone involved.
Couldn't agree more, Lyra. For healthcare professionals who are already using or thinking about using VR in their practice, knowing that companies like Neuro Rehab VR are working to address those ethical considerations should provide an extra level of confidence. It's so important that we remain mindful of these challenges, but it's also encouraging to see solutions already being developed that help alleviate these concerns.
And it's only going to improve as more clinicians engage with systems like the XR therapy, providing feedback and helping to shape the future of VR in rehab. This collective effort is how we ensure that the technology doesn't outpace ethical best practices.
This has been an amazing discussion, and I hope our listeners found it as enlightening as I did. Thank you so much, Lyra, for sharing your insights. I think we've given our audience a lot to think about today.
Thank you, Brie. I always enjoy our conversations. And to our listeners, thank you for joining us once again. The world of VR rehabilitation is filled with opportunities, but as we've discussed today, those opportunities come with responsibilities. Balancing innovation with patient safety is key, and together, we can make sure that this incredible technology fulfills its potential in the safest, most ethical way possible.
Absolutely, Lyra, and that's a wrap for today's episode of Beyond Reality. If you enjoyed this episode, be sure to subscribe, leave us a review, and share this with your colleagues. Let's keep the conversation going on social media as well. How do you see the ethical challenges of VR playing out in your practice? What's worked for you, and what are the challenges you're still navigating? We'd love to hear from you. Until next time, I'm Brianna Hodge, and this is Beyond Reality. Stay curious, stay informed, and we'll see you in the next episode.